Hello, my name is Alex Verbrenovich. I oversee Lacer's Health Benefits and Wellness Division. And this is the open enrollment meeting for Kaiser Permanente. And so this is your chance to learn more about the Kaiser Permanente plans we offer and get your questions answered, start to compare and contrast and make sure you get the information you need to make the best open enrollment decision for you and your family. We're all here to answer questions. Of course, sometimes after the meeting, the questions pop into your head, and that's totally fine. We are here for you. You can reach us by email. You can reach us by phone. We've got these wonderful health plan advocates and enrollment staff that are always ready to help you at any time. Day or night, day and early evening. They do go home at night, and weekends. But while we're in the office, we are there for you. So always reach out to us. All right. So as you know, this is open enrollment for 2022. And just as a reminder, open enrollment is being held October 15th to November 15th. And during this time period, you can enroll in a plan if you're not already in a LACERS plan. You can change your plan, or you can add dependents. After open enrollment, the only opportunity you're going to have to either change a plan or add a dependent is really going to be based on a qualifying event, such as moving maybe to a different location and the health plan you're currently in doesn't serve that area. Now, I want to make sure you're aware that this past open enrollment was a different kind of open enrollment, right? So we typically have it October to November like we are this year, but because we had a special retirement incentive program that was being administered while open enrollment was happening, and we were basically deluged with lots and lots and lots of work, like 3 times the amount of work, we made certain exceptions for last year's open enrollment. So we extended it from November 15th all the way to the end of March. And then we gave staff a 3-month window to process enrollments. So instead of open enrollment ending on November 15th and all of your open enrollment changes taking effect January 1st in the coming year, you could have put in for an open enrollment change up till the end of March, and then we would have had 3 months past that time to process the enrollment. So because of that, if you made an open enrollment change and it took effect on February 1st or after this year, you can't change that change this time. So you would have to wait until the next open enrollment period next year. But if you, for instance, change your dental plan during this past open enrollment, and this time you want to change your medical plan, that's okay, because you didn't change your medical plan before, you only changed your dental plan. So just to keep that in mind, obviously, if you have any questions, we'll be happy to answer that for you. Okay, moving on. I also just want to announce that we're having another great year. We just keep having this lucky streak. And I don't want to say it's lucky necessarily, because a lot of it has to do with all of you, all of our wonderful members, going in, getting your screenings, taking good care of yourself, not waiting to the last minute and having these emergent situations. But overall, our premium costs for next year we're actually looking at a decrease of 1.3%. Overall, the estimated premium cost for next year is going to be $152 million. So that's to provide coverage to all 24,000 covered lives that we have in our plans. That's medical, dental, and vision. It's kind of an incredible number when you look at that, 152 million. But the nice thing is you're not paying most of that out of pocket, right? All of you worked really hard for the city. You earned a subsidy benefit. That subsidy benefit that all of you received covers about 95% of those costs. The other 5%, some members pay out of pocket through their monthly allowance deductions, but it's amazing to think that out of $152 million, we're covering about 95% of that based on your hard work and service to the city. And the nice thing is, even though we had a reduction, there's some really great additions to the benefits. And so we just give, we're just givers. All right. In terms of the maximum subsidy, it is increasing. As you may know, the board has the authority to increase the maximum subsidy based on the increase in the premium cost of the Kaiser two-party HMO plan. So for next year, that plan's premium is increasing by $93.70. And so the board did authorize an increase in that amount. So the maximum subsidy is changing from $1,790.80 a month to $1,884.50 a month. And I think that's a nicer number anyway. And that's the same for the medical premium reimbursement program. That's the maximum reimbursement amount you can get. Dental subsidies will be $44.60 a month for the PPO plan, and that's not changing. And the board doesn't have authority to change that unless the active side, the personnel department, changes their subsidy for employees. But they've been keeping it flat for the last few years, so unfortunately the board has to keep that amount flat. If you're in the Delta Care USA plan, the maximum subsidy is going to increase to $15.10 a month. Now, if you're thinking about making a plan change this year, there are some things I want you to keep in mind. Again, I mentioned if you're moving, there's a possibility that your current plan or the plan you're thinking of changing to won't serve that area. So again, if you have a move, a change of residence in mind in the plans, check with us or check with the carrier to make sure that they actually serve the zip code you're moving to. Also, if you are on medications, make sure you have sufficient medication to get you through the transition period, just in case there's some strange hiccup. I'm not saying that will happen. It most likely won't happen, but you never know. Plan for the worst, expect the best, but plan for the worst, right? So just make sure, maybe get one more refill, just by the end of the year, talk to your provider. I'm sure it won't be an issue. And then, there's always coordination of care. If you're in the middle of treatment and you're switching to a new plan, just make sure your new plan's aware of that, and they can work out the details with your current plan. And then another important tip, if you think you want to keep your doctor, make sure that they will accept the new plan. And even if they accept the new plan, make sure they're taking new patients, because a lot of the times they might accept the plan, but they're not accepting new patients. And so then you'll be stuck. So just make sure you're clear on that. And then just be aware that any new premium costs, deductions, subsidies, all the new changes, that takes effect with your December paycheck. So the check you're going to get at the end of December will reflect any changes in your cost. And of course, you can review those costs in the health benefits guide. Just so you know, we do have other open enrollment meetings going on this year. So for the Anthem HMO and PPO plans, and these plans are for people under age 65 or enrolled in only Medicare Part B, Tuesday, October 26th, we will have a meeting for them, for those plans. The United Healthcare Medicare Advantage plan for people with Medicare Parts A and B, their open enrollment meeting is going to be Thursday, October 28th. SCAN Medicare Advantage plan for people with Medicare Parts A and B will be Tuesday, November 2nd. And then a combination of Delta Dental and Anthem Blueview Vision will be on Thursday, November 4th. All of these are at 10 a.m. Now, we are replacing the Medicare supplement plan that we currently offer with the Anthem Medicare Preferred PPO plan. It's a Medicare Advantage PPO plan. A lot of people are really interested in this plan, especially if they're in the Medicare supplement plan, because they're being automatically transitioned over unless they opt out. So we're having, because it's affecting so many people, we're having 4 meetings during this open enrollment period on each Friday. So this Friday and the following 3 Fridays at 10 a.m. If you're interested in knowing more about that plan, you can join one of those meetings and learn more. Other than that, everything you need to know about open enrollment is on our website. You can just go to www.lacers.org, click on the retiree tab, and then click on open enrollment. If you go to the retiree page on the left, you'll see health benefits, click on that, and then you'll find open enrollment. And we've got everything there. We've got all kinds of health plan benefit information. We've got digital copies of your benefits guide and overview. There's all kinds of wonderful resources that the carriers have provided, so you can access some of those to get a little bit more information about different programs and offerings through the carriers. If you want some more personal assistance, you can go ahead and fill out a form, and every Friday I check that and make sure we get in contact with the members, and if they want to talk to the carriers, we can arrange that. A reminder to just make sure you get your enrollment forms in no later than November 15th. It's really important because that way we can process your forms timely and there won't be any hiccups getting you your plan change effective on January 1st. And then if you did submit something and you want to see that if we got it, you want to check with us to make sure we got it, give us a few days because we're dealing with a high volume of work right now and it takes us a little time to get through everything. Plus, if you've sent it by mail delivery is a little slower these days. So give us at least 3 days before you call us to check on whether or not we received something. And again, you can reach us at lacers.health@lacers.org or by calling our main number at 800-779-8328. We're no longer doing, well, I should say we're no longer doing in-person visits, but for now we're not doing in-person visits. I think in the near future, we'll be doing it on a limited capacity, and hopefully soon, within a few months, we'll be able to, see everybody in person, face to face. But for now, we want to be safe, and so we're limiting it to virtual or phone or email. So that's pretty much all I have. Hopefully that information is good and you don't have any questions. But again, as I said, we're always here for you if you do. And with that, I'm going to hand it over to the most wonderful Stephanie Smith, who oversees our wellness program. And she's just going to give you a little presentation on our wellness program. Take it away, Stephanie.
Hello, everyone. Good morning. And my apologies for the redundancy for the presentations. We wanted to make sure that we address those members that did not have an opportunity to attend the meeting on Tuesday. So wanted to say good morning and welcome to today's meeting. I'm the Lacers Well Program Manager. I'm responsible for the operations and the program planning. And we also have Crystal Baldwin that you heard from this morning. She's responsible for the Champion Volunteer Program, as well as the Lacers event planning. And we also have Betty Smith. She also assists with welcoming our newly retired members to Lacers Well Program. Crystal, she'll be sharing information about our Champion Volunteer Program later on. So be thinking about becoming a champion. We really would love for you to participate in the program. So with that, the Lacers Well program, we're here to enhance the quality of your retirement by providing resources and activities to make your retirement life better, to improve the health outcomes and your overall well-being. The program was created in collaboration with the health plan carriers like Kaiser here today to help control healthcare costs, resulting in savings that could be invested into support programs such as transportation, meal delivery, and home care, and other valuable resources that helps you make your retirement better. So the program does promote a purposeful living campaign based on 5 elements of well-being. That's purpose, physical health, financial wellness, social engagement, and community involvement. So Laser as well, we provide so many opportunities for you to engage with us virtually right now. Hopefully next year sometime in person, we'll be able to get back to seeing you all in person. And so we're really looking forward to that. But in the meantime, we've put together so many offerings for you to engage virtually. So in January, we launched a health assessment purpose survey for retirees to evaluate how they're doing in various areas, such as pain, movement, and functionality. Participants, they also answered questions in an effort to discover their interests that support purposeful living. During the year, we engaged with expert clinicians, Dr. Doris, Dr. Musai, Dr. Pryor, and Dr. Fakhrbadi to give us presentations on issues such as mental health, as well as COVID-19 updates. We also had Elijah here that gave the tech review from Mom's Computers. He also conducted monthly tech classes for retirees to learn tips. Hey, Elijah, to learn tips on using their computers, smartphones, tablets, and the internet. And the financial workshops, they did not disappoint. We had an overwhelming response to those workshops. We had a financial mastery and retirement and scam series, as well as an estate planning workshop. We had almost 300 attendees. If you missed any of those workshops, don't fret, they are recorded. You can visit our Lacer's YouTube page in order to get more information and learn more about those workshops. So right now I'm going to hand it over to Crystal to talk about the Champion program.
Thank you so much, Stephanie. And it's so good to see each and every one of you on here this morning. The Lacer's Champion program gives retired members such as yourself. Some of you have over 25 years of service, over 30 years of service with the city. You're loaded with a wealth of knowledge and experience. And this program gives you an opportunity to join our team, and to work with us to share your wisdom, your knowledge, and your experience, and to help us with coordinating and promoting this wellness program. And so, as you can see here from this particular slide, we have retired members who have hobbies and skills and things that they like doing on a regular basis, and they want to share it with you and with the rest of our retired members. We have indoor and outdoor activities that we've actually started back up. As you can see, we have champions that do a walk at the El Carrizo Park. We have walks in Sherman Oaks and the Van Nuys area, the Whittier area. And when the pandemic hit, we also recruited champions to start virtual activities. And as you can see, we have Cooking with Carmen that she does via Zoom. We have our virtual book club, and we have 3 virtual book clubs that are in operation right now: a virtual hula class and a virtual movie review class. That's all done via Zoom, if you're not comfortable with going out and interacting in person at this time. So this program is going to give you an opportunity, if you have a skill, a hobby, something that you do, to share with other members and to help, because this program is about the well-being of our retirees and making sure you stay healthy. So we also have volunteer opportunities. When the pandemic hit, we recruited champions, and some of you are on here today, who actually worked and helped us to facilitate our volunteer phone bank, which reached out to members during the pandemic, provided them with resources, and we still have that phone bank going on right now. However, we're just providing the resources and things that they may need. We also want to recruit volunteers to assist us with the Aging Mastery Program. And some of you, such as Voss and some of the rest of you, were a part of the Aging Mastery Program. So if you are interested and have something or an idea, a tour that you want to take, a museum tour, anything that you would like to do, please reach out to me or Stephanie. The information is listed here, and email us and let us know what you would want to do. Okay, back over to you, Stephanie.
Thank you so much, Crystal. As she indicated, these are our mobile numbers here. You can jot those down. You can call us, you can email us, lacerswell@lacers.org. Also, check your email for monthly retiree updates and calendar of events. Those go out the last week of the month. One just went out yesterday, and then the first week of each month. So if you're not getting those emails, please check your spam or reach out to Lacers to make sure we have your current and accurate email address on file with us, so that you're not missing out on those wonderful opportunities to engage with the Lacers Well program. Also, visit us via the events page. That link is listed here, as well as we have a calendar out on the website as well. And then lastly, we have YouTube workshop recordings out there. If you've missed any of our events or virtual events or even our prior in-person events, you can locate those out on YouTube page. We'd love for you to subscribe or visit our Facebook page. We have well over almost 700 subscribers to our Lacers Well Facebook group. So we'd love for you to engage on Facebook. So with that, I'll now stop share right now and give it over to Marisol. So Marisol is our representative for Kaiser Permanente, and she's a wonderful, wonderful partner with us. Kaiser has been such great partners with us at providing you with all your healthcare needs, and we just really love working with the Kaiser team, and I really appreciate them taking the time out of their day today to present to you a Kaiser open enrollment presentation. So I'll now give it over to Marisol.
Thank you, everyone, for joining us today. It's a pleasure to be here for open enrollment. I do miss seeing everyone in person. So what I'm going to do today is I'm going to provide you with a presentation on the different tools and resources that you get as a Kaiser member. And there's a few new things that have come on board since we last did a presentation for open enrollment. So hopefully this is going to be rewarding information for you. So with Kaiser, most of you already know, how we manage your care. But for those of you that may be new or are thinking, you haven't used the plan for a long time, just wanted, to remind you that, with Kaiser, you get connected care. We're your health plan as well as your provider. So your doctors, hospitals all work together to deliver that care for you. Your care is connected with your electronic health record with the provider. So when you're going in for your primary care visit or specialty care visit, or even if you go to pharmacy, all of your providers at Kaiser have information about you. So they don't have to be faxing or sending information over, because all they have to do is look up the information in the computer and get that information about you. You also get, in my next slide, I'll talk about your primary care doctor, but in terms of specialty care, there are some specialists that you can self-refer to. So OBGYN, mental health, optometry, and also the allergy department. So why is that important? It's important so you know that you don't have to go through your primary care doctor to request a referral to see your specialist. You can bypass your primary care doctor and go directly to that specialist when you need to do that. So quality care with you at the center. Your primary care doctor is your biggest advocate. A lot of people, when they join Kaiser, they think that they don't have to select a primary care doctor, or how do they select a primary care doctor? So just as a reminder, we do want you to select a primary care doctor because he is your biggest advocate. He is the one that's going to coordinate your care. He's the one that's going to, you're going to go to when you need to see a specialist. Kaiser Permanente has been a pioneer on preventative medicine. So we believe in that, in making sure that you come in for those type of screenings, preventative services, your annual checkups, because we want to take care of you when you're healthy. And also we want to be able to manage any chronic conditions that you might, be diagnosed with. If you are diagnosed with a chronic condition, at Kaiser Permanente, we take care of everything for you to manage that chronic condition from the time that you get the diagnosis all the way to when you need medication. We do put you on a registry in a disease management program where we manage that for you, so you don't have to think about your next appointment or who do you see for those specialists for that condition. So just know that we will coordinate that and make that a personalized care for you. So here's a nice question. So, if you want to participate, when was the last time you needed care? What did you do to get it? So if any, Stephanie or Crystal, if you see any answers in the chat, maybe share a couple of answers.
Okay, let's give everyone a moment. Look into your chat at this moment and just respond to this question. When was the last, or what was the
last time you needed care? What did you do to get it?
Thank you.
Okay.
What did you do to get it? Did you call? What did you do? Did you visit somewhere? Where did you call, or when did you?
Yeah, so.
Okay, so Lily said she made an appointment with her primary care doctor.
Okay, yeah, so there's different ways to get care. I just wanted to get more information on, maybe did you do a phone consultation? Did you do a video appointment? Maybe you did a face-to-face. So everybody's needs are different. So thank you for that.
So Bernie said that she requested a phone appointment.
Perfect. So that kind of leads me to my next slide. Thank you so much for your participation. So at Kaiser Permanente, as a member, you have many ways to seek care. You have same day, next day appointment. You have video appointments. You have telephone consultations. We also have a 24/7 nurse advice line that you can call. And you can email your doctor. So we have kp.org, which is available to you. Once you sign up, you go into our secure member site and you can email your doctor with non-urgent questions. Typically, a doctor will respond to you within 48 hours and to your questions. Another way to communicate with your doctor or seek a provider visit is through an e-visit. I'm not sure how many have already experienced scheduling an e-visit, but through an e-visit, you go to kp.org or through the mobile device and you schedule an appointment, and it's the appointment field is going to come up and you're going to see e-visit, and you click on an e-visit and then you fill out a questionnaire. And based on what you answered in that questionnaire, your doctor or the provider will write a prescription for you. And all I have to do is pick it up at the pharmacy. Or maybe the doctor will say, do this or go to urgent care. If they need to see you, they'll tell you, and they'll be able to send you a response saying that you need to see a provider and make an appointment. But it's very simple. So telephone consultations, video appointments, and e-visits are all free. So there's no cost to you to schedule those type of appointments. And because of what we lived with this pandemic, a lot of our face-to-face visits, were all done through video and telephone consultations. We did open up the facilities where we are now scheduling face-to-face visits. So just wanted to let you know that you can, make sure that that you can contact your provider to schedule those type of visits. And just, that describes all of our telehealth services that are available to you. I kind of talked about the app. So if you haven't downloaded the app, Kaiser Permanente has an app. And so once you're registered on our website, you can download the app on your mobile device. And a lot of the features that you can do on the desktop, you can also do on the mobile device. And, just an example, email your doctor, make appointments. You have your digital ID card on your mobile device. And then a couple years ago, we also added a feature where you can pay your bill online as well as using the app. And then you can find locations on the app. So it's very convenient. So I would encourage you, all of you, to sign up on kp.org as well as download the app on your phone. So regarding care while traveling, our members are covered for urgent care and emergency anywhere in the world. One important thing to to know when you, as a Kaiser Permanente member, is that you have access to any Kaiser facility where in the area that you're visiting. So I use Woodland Hills as my own, my primary medical office. But let's say I'm in Orange County, I'm in Riverside, maybe I'm somewhere in Northern California visiting my friends. I can use those Kaiser facilities. So you have those member benefits where if you are in an area that has Kaiser Permanente, you have access to those facilities. What we started a couple years ago is we have a partnership with Minute Clinics and Concentra Urgent Care Centers. So in different parts of the country where Kaiser is not in, okay, so the key word is in those areas that Kaiser does not have a facility, in one of those states that Kaiser does not operate, you now can visit a Minute Clinic or a Concentra Urgent Care and access services as a member simply by paying, by showing your ID card and seeking services. The exception to that is for Medicare. So our Senior Advantage members will continue to, they can go visit Minute Clinic and Concentra, but you would actually have to pay out of pocket for those type of urgent care services and then seek reimbursement from Kaiser Permanente. But that's only for our Medicare Senior Advantage members. For more information, you could always visit kp.org/travel. We do have a dedicated line that you see on your screen where you can call to, maybe you're in an area that doesn't have Kaiser, you need to be, you need to know who the nearest Kaiser Permanente facility is. Or maybe you did seek services somewhere and now you need to seek reimbursement. You would call that dedicated line. Or maybe I'm traveling and I need an earlier prescription refill of my medication. That's the number you would call and they will coordinate all that for you. We do have a national contract that's set up with Minute Clinics and Concentra in 33 states, including Texas, Florida, New York, Pennsylvania, and Illinois. So here's another question. If you have a serious health condition, do you know how to find the right doctor?
So if you can locate your chat function and respond to the question, please. If you had a serious health need, do you know how to find the right doctor? Okay, so I see other questions in the chat. Okay, so PK said, call the number on the back of your Kaiser card.
Okay.
Melissa said, call Kaiser Health Nurse.
Perfect. Yes, thank you so much. It's important to know that, either if you're using your health plan or not, thank you for those answers. So at Kaiser Permanente, your personal doctor can connect you to the right doctor in terms of specialty care, and those answers are correct. If you want to know how to seek a provider, you call the advice nurse, or you can call your primary care doctor. You can email that doctor as well. And then you also have kp.org where you can find locations and providers by zip code, and just to get an idea of the different specialties that are part of that medical clinic or medical center that you access care. So in terms of our specialty care, you receive specialty care from top-notch doctors at Kaiser Permanente. We have one of the largest multi-specialty medical groups in the country. So when you're talking about cancer care, cardiac care, we connect you with the right specialists. Our experienced specialists combine early detection, cutting-edge research, and compassionate care. And we have access to groundbreaking clinical trials and other cancer research. Cardiac care, from your initial diagnosis through treatment into recovery, you and your doctor will make decisions about your care. So you are, between your primary care doctor and your specialist, they tailor a personalized treatment plan for you, and it's a 360-degree approach. So again, just be confident that when it comes with for specialty care, you can trust us in making sure that we do coordinate those services for you. And one thing I do want to mention is, as you see on your screen, we do have different dedicated landing pages on kp.org. Again, cancer care, cardiac care, where we provide a lot of wealth of information about that condition and the resources that you have to manage that condition with your doctor. So we in terms of physical health, we want to make sure that you come in for those screenings or preventative services, you know, and we also want you to take care of your mental health being. We combine, you know, all this information for you, but we also combine and put mental health as being a priority for you. And we want to make sure that you also know the different support services that we provide. So Kaiser Permanente provides clinical and support services for a wide range of conditions when it comes to mental health, anxiety, stress, depression, drug dependency, and autism spectrum disorders. Our mental health team includes psychiatrists, psychologists, as well as marriage and family therapists, addiction medicine physicians, and medical social workers. One thing to as a reminder, which I said earlier in the presentation, is mental health is a self-referral. So, you know, if you need to seek these type of services, make sure that you know it's a self-referral. You don't have to go through your primary care doctor, thus saving yourself a co-payment. You would just call the mental health department for the area that you're in the area that you're seeking care, and access that and make an appointment directly with that provider. Another dedicated page that we have on kp.org, which is specialized, you see it on your screen, is that kp.org/mental health. Again, a dedicated page for mental health where we provide resources and explain to you the services that are provided to you as a member. So I'll mail order pharmacy. It's important to know that there are different ways to order your medication. You could do it by phone, you can do it online, and you can do it, you can actually pick it up. So know that those are different ways. But if you do sign up to get your prescriptions when you order it online, you can get you know, a 2 months 100-day supply of medication for 2 co-payments. So you'll see a savings of 1 co-payment there. That's on one plan. When I talk about the plans, I'll go into the pharmacy program. You also, there's no charge for shipping. One thing to remind everyone is that when you do that, you're not driving into the pharmacy, you're not waiting to go into the pharmacy to get your prescription. So it's saving you time there as well. And then when you sign up to get your medication, when you do it online and you sign up to get notifications on your phone, you can get status updates of your medication. You can get refill reminders. So just know that that's available for you. It's very convenient just to get a little notification to say your medication is ready, either for pickup or when your medication is going to be delivered to you. One new thing that we do have this year that we started is if you want to have a same day or next day delivery, it is available for an additional fee. So we know that these days you can have anything delivered to your door, right? You buy something online and you want it that same day. So we're paying extra money for that, right? So now we're with the pharmacy program. If you do want something rushed, same day or next day delivery, there is a small fee for that. We do have our formulary online. You see that on the slide where you have, it's a public formulary that you can go online to check if a medication is covered. And then you see the phone number on the screen as well, where you can call to inquire about your prescriptions. As a member, you have many resources when it comes to wellness. We want you to know that you have wellness resources online through our healthy lifestyle programs. You also have wellness coaching that's offered to our members for free. So you can speak with a wellness coach online on weight management, nutrition, maybe you want to quit smoking cessation. So there's different topics that you can schedule an appointment with the wellness coach. And again, all those sessions are done over the phone. You also have online programs through our healthy lifestyle, healthy lifestyles online. When you register for those programs, all of the information that's given to you will be sent to you via email. And again, there's a lot of programs: back pain, stress management, nutrition, weight management, sleep. Again, those, when you enroll, those programs are free to our members. And you also get reduced discounts for complementary medicine when you want to, go in for a massage therapy. If you want to get, discounts, you can always go into that website, kp.org/choose healthy. And I kind of went backwards on the slide, but kp.org classes. So we have classes that you can attend in our facilities. However, because of the pandemic, we've actually put a hold on those classes, and all of our classes are done virtually. So if you go into the website, kp.org/classes, and look up the area and the facility that you want to go to, you'll see that they've posted links of virtual classes that you can attend. And then our seasonal farmers market is closed. So right now we're not operating the seasonal farmers markets. And then going back to the top of your slide, exercise and self-care apps, we do have a service that we started providing our members last year called ClassPass, and it provides members with on-demand video workouts and live stream fitness classes, including Pilates, dance, and boxing. And then as a member, you also get access to Calm and My Strength. Calm is the #1 app for sleep. And then My Strength is more of a mental well-being app where we connect you with different resources. It has different assessments that you can take to just kind of, tell yourself how you're feeling that day. And it'll provide you with different resources on how to cope with maybe a stress, with anxiety. Calm and My Strength are available to our members for free. And to register, you would go through accessing the link, and then you would through kp.org. So you would click on kp.org/self-care apps. It directs you to kp.org. You go into with your login, and then you'll get into the landing page of Calm and My Strength. And when you get to that landing page, you can either register for Calm, or you would register for My Strength. And then you would register with a different password and user ID. And then when you do that, you've registered on kp.org's portal, and then you can download the Calm app and the My Strength app on your phone. Okay. So you remember, you could all these different links take you directly to Kaiser Permanente, where you actually have to come in with your user member login, and then you register individually for the different services. Okay, a fitness membership, Active and Fit. This benefit is a new benefit as of this year for the non-Medicare members. So where you have access to more than 13,000 gyms, and in your membership, you have access to workout videos. You also have access to requesting a home fitness kit. This is, again, a service that's provided to you if you're a non-Medicare member. It's an added benefit that you can enjoy for free, because you're not paying extra for this benefit. It is actually part of your being a Kaiser Permanente member. And if you want to join, you go to the website on the slide, or you can also call maybe to inquire about if they have a participating gym in the area that you want to go to. So that number is very accessible, and you can call to get that information. So Silver and Fit. Silver and Fit is our fitness program that we offer to Medicare Senior Advantage members. So as a Senior Advantage member, you can also, join have a gym membership where you can select a local club from the network of Silver and Fit. The program includes access to cardiovascular and strength training, Silver and Fit group exercises, yoga, Zumba, Tai Chi, swimming. So you have a lot of good resources when it comes to Silver and Fit and what they provide. And then you can also take some of their Facebook and YouTube classes as well. So you can register and select a nearby facility at silverandfit.com. So this is a new benefit that we have, we'll be starting for our members, for our retiree members as of 1/1/2022. Upon discharge from an inpatient stay at a hospital skilled nursing facility, your care team can refer you for delivery to your meal delivery to your home. A representative from the meal provider will call you to talk about available menus, options, and schedule a delivery. So you can choose for more than 70 menus, and there's a lot of different recipes. If you have a condition that doesn't allow you to eat everything, then you can actually have them tailor a personalized meal for you. And you get 3 meals per day and a total of 84 meals that your plan covers. And then you can always call our member service contact center for more information. Again, this is a new benefit offering to our Medicare eligible members as of 1/1/2022. And this is, again, a reminder what you have. This is not a new benefit. You can get, if you need a doctor if you need a ride to the doctor, your plan covers that. You get a ride visits at no charge. Your plan covers 24 one-way trips per calendar year. You can get rides from doctor's appointments and medical services. To schedule a ride, you need to call us with at least 3 business days before your appointment. And there's the numbers there for you to see. Okay, so up next now I'm going to talk about your benefits and a high overview of the locations for Northern and Southern California. So there are no plan changes in either plan except for the Medicare where we added the meal plan. There are no changes, so just a very high overview. Again, your doctor visit is $20, whether you go for specialty care, primary care, or urgent care. Your lab and tests are covered at 100%. Your hospitalization is covered at 100%. Emergencies, $100. We do waive that emergency copayment if you're admitted into the hospital. I did say urgent care, so urgent care is $20. And I forgot to mention that our urgent care facilities operate from 9 a.m. to 9 p.m. So know that that's something that, we change our hours of operations to better serve our members. And we have urgent care facilities during the day. And then your prescription benefit is $15 for generic, brand is $35, and specialty medications $100. I talked about the mail order program. So for this plan, if you are taking any maintenance medication, it would be very useful to use the mail order program or to order by mail. Well, you get a 100-day supply of medication for 2 co-payments. So it would be $30 for 100-day or $70 for brand name. Specialty medications will only be dispensed at a 30-day, up to a 30-day supply. And special medications are those high expensive ticket medications, for cancer, hepatitis, multiple sclerosis. Those are all considered specialty medications. And then the maximum yearly out of pocket, just as a reminder, everything builds up to counting to the out-of-pocket maximum. And that's like your consumer protection, that once you hit that, then your Kaiser Permanente pays for most services at 100%. So this is the Senior Advantage plan for for anybody that is over 65 and is eligible for this plan, and you could be eligible for this plan if you only have Part B. Again, you have your maximum out-of-pocket cost, which is $500. You have your annual preventative checkup covered at 100%, your doctor's visit $15 copayment, lab and radiology is covered at 100%, hospitalization 100%, emergency 50. Again, reminder that if you get admitted using the emergency room, then we waive that copayment. You have your ambulance transportation benefit. As I mentioned earlier, this plan comes with eyewear as well. Well, you have either eyewear or contact lenses covered every 24 months with an allowance of $150. So we will pay up to $150 for eyewear. Hearing aids, again, every 36 months. And you have that allowance of $2,000. And then your prescription benefit on this plan, you have a 100-day supply, whether you do mail order or walk-in pharmacy, you will just get dispensed a 100-day supply for one copayment. You also have chiropractic and acupuncture benefits on this plan. It is an added benefit to both plans, and it's not through Kaiser Permanente, it's through our contracted network of chiropractors, American Specialty Health Plans. And they are the ones who administer this benefit for us, and the network that we use, I should say. And you have a $15 copayment per visit, and it's a combined visit of 30 visits. So for chiropractic and acupuncture visits per member per year. So new locations in Southern California, Kaiser Permanente continues to expand in many, many areas. On your screen, you'll see that we have now opened a Playa Vista Medical Office, Claremont, and Hesperia Medical Offices. Soon to open our cancer specialized cancer center at Los Angeles Medical Center, and our Downey Center expansion. We currently have a medical center there, but it's getting bigger. They're remodeling and making it much bigger. And then the new Watts Medical Office that's also being remodeled. And then locations in Northern California, as you see now open, we've expanded a lot in different areas. We have a lot of medical offices that are new, and soon to open is going to be the Care Essentials in downtown San Francisco, and that's scheduled to open in 2022. Okay, so one thing that I did forget to, before I go into and explain this slide, as a member, when you're visiting one of our Kaiser regions, you now can create a travel account. And I'm actually going to put that information in chat and then provide it to the Lasers team, where you call a number and set up a travel account. So if, let's say, I go to Colorado a lot, and now I want access to my medical record, and I want to be able to communicate with the providers in Colorado, I can call Kaiser and set up a travel account in Colorado, and they'll give me a medical record number. And now I can view my records when I'm visiting the Colorado Kaiser Permanente. So that's actually a new service that we're providing to our members. And then the other second thing that I wanted to mention before we're almost done is that as a member, I'm not sure if you know now that you do have now a way to send a chat to member services. So now you can, instead of sending an email or calling, there's a feature on kp.org under the support center of kp.org, where you can click and chat with member services. On your mobile device, it's when you open it up, it's under Contact Us, and then you can start a chat with member services. Okay, just wanted a couple of new things I just remembered to mention that are new with Kaiser. So just if you're not a member and you're thinking of joining Kaiser Permanente, as soon as you join us, we want to make sure that your care experience is easier. So within 10 days of joining Kaiser Permanente, you'll get a personalized welcome book in the mail, a welcome call, and your ID cards. And once you make your first appointment, you also get a pre-visit call. One thing to just remember, if you're not registered on Kaiser's website, go to kp.org and register on our secure website. It's available to you 24/7. It's easy to use, and it's convenient. And again, if you don't really need to make an appointment with your doctor, a face-to-face appointment, you can make an appointment online with your provider and schedule that telephone or video appointment or e-visit with your provider. Okay, so if you have any questions about the information that I discussed today, if you're a new member and you want to learn more, or maybe just, have a question about our doctors and facilities, we do have a dedicated line. Our enrollment specialists are available to answer any questions that you might have at that number that you see on the screen. They're there to answer any questions that you might have, any information that I provided to you, and you want more information about that, they're there to answer those questions. Okay, so now my last question to you. What makes you feel happy and healthy?
So in the chat, if you can place your response to this question in the chat, what makes you feel happy and healthy? Okay, lots of responses here. Melissa says staying well. And Fern says a good meal. I have to agree with her on that one.
Okay, good. So yeah, there's a lot of things that can make us happy. I mean, we are, it's good to make sure that we take care of ourselves, make sure that self-care is important for all of us. Now that we've entered this, what we've experienced in the last year and what, God, almost 2 years now. Make sure that you take care of yourself physically, mentally. Self-care is very, very important. So yeah, what makes me happy and healthy? I mean, family, friends, hobbies. I like hiking, being outdoors. And now that we can be outdoors more, that makes me even happier. So everyone's different, and you might have more than one thing that makes you happy. So whatever makes you feel happy, that's your healthy place. So thank you so much for attending the presentation today. And now I will open it up to any questions that anyone has in the chat.
How difficult or easy is it to have access to an outside specialist for a second opinion? What do I need to do?
Okay, so that's a great question. What happens first is that, you do have a second opinion that's covered when you go within Kaiser Permanente. So, if you exhausted that, I'm not sure if you did. However, so we start within Kaiser first. You go to your primary, then you go to a specialist, and then that's because we're a network provider. We own and operate our own facilities. So we have our own doctors, facilities, and so on. If you need to be referred outside of Kaiser Permanente, that's a conversation that you have to have with your primary care doctor. And there has to be a medical necessity. There also has to be, a reason, is it that we don't have the expertise? Do we not have the equipment? Do we not have the facility that specializes in that condition? So there's a lot of factors that are taken into consideration. And that again is be asking your primary care doctor for that.
Well, my question then is, we are talking about cancer, and City of Hope is a national cancer institute, which Kaiser is not. So if you want a second opinion there, you may have doctors at Kaiser, but they may not be of the same caliber with the same experience that a national cancer institute would.
Right. absolutely. So I definitely understand your question. And so you would have to go through your primary care doctor or the specialist that is treating you, or, you know, and be able to go through that process. There's a process to request that. Not to say that we don't refer outside of Kaiser Permanente based on medical necessity. So again, it has to be done through medical necessity, and it has to be authorized by the board for you to be, for anyone to see an outside provider.
Okay,
Hold it.
thank you.
What will be the medicine, brand name medicine in 2022? Will it be still $15 or more?
For what plan?
Medicare Senior Advantage.
Let me bring it up real quick. 1 second.
Yeah, I missed that, I think. Yeah.
Yeah, so for your prescription, it's $15, whether it's generic or brand.
Okay. And my next question is, Marisol, that when will the Moderna booster will be available to 65 and above? I'm looking for my wife. I got it Pfizer, but looking for my wife.
Okay, so it's your question is on the booster shot,
Booster shot.
and it's for Moderna, right?
For Moderna. Yeah.
Yeah, so at this time, I don't have that information right now. It's only for the folks that have received the Pfizer vaccine, that boosters are available. So, you know, for any more updated information, I think I put in the chat, or Stephanie put in the chat that you can get up-to-date information on Kaiser's website about our booster status. But right now, it's still Pfizer are for the folks that have Pfizer, and then, you know, we're following that criteria, that age criteria of, you know, older than 75, older than 65, and then 50 to 64, 18 to 49, and 18 to 64, with different underlying conditions. So yeah, so I don't have information on Moderna because we still haven't, it hasn't been approved yet.
Okay.
So this is Tom, and I just wanna-
just 1 minute. Just 1 minute. Okay, my question in continuation to that was that when I got Pfizer, I got the booster notification. So will they be sending the Moderna booster notification as well, or we have to keep on the lookout?
So when you became eligible to get the booster shot for the Pfizer, they'll reach out to you. So your primary care doctor will send you an email notifying you that now you've entered eligibility for that, and to contact Kaiser directly by phone, or you can schedule an e-visit, because e-visits, you can schedule your boosters through that e-visit.
It's more convenient. Yeah.
Yes, it is.
Yeah. Thank you so very much.
Welcome.
Appreciate
Yeah,
it.
I was going to
So-
say, boss, that I read this morning that the FDA just approved boosters for Moderna and Johnson & Johnson and cross booster shots. But that has to still go through approval of I think the CDC. So they said it might take a few days still before that gets approved, and then it'll probably take a little while longer before it gets you know, administered through all of our healthcare.
Yeah, it has been technically approved, but still I called yesterday Kaiser. They have no information as to when they are going to start the Moderna. So
Yeah, it still has to be approved by the CDC, I believe. And
Right.
then yeah.
thank you so much.
Good morning, this is Jamie. Jackie stands for Jamie Chuang. Yeah, I moved away from California and I want to continue with KP. How can I do that? Or am I automatically off of the plan because it's only for California?
I can take that. Yeah, unfortunately, Lacer's Kaiser plan is only available in California. So what state did you move to?
Hawaii?
Hawaii? Oh, yeah. So what we would have available to you would be either the Anthem PPO plan if you're under age 65, or if you're enrolled in only Medicare Part B. Or if you're over age 65, then you would be eligible for the new Medicare Preferred PPO plan by Anthem. Also, what would be available to you is our medical premium reimbursement program. Because you live outside of California, you would be able to enroll in a plan of your choosing, and as long as it meets certain criteria, and then you pay the premium cost, but we would reimburse you the premium cost up to whatever your subsidy amount is on a quarterly basis. So you would have to be out of pocket on a quarterly basis, but we would reimburse you up to your subsidy amount. And you can contact us for more information on that program.
Okay, thank you.
Sure.
Can I cover with my spouse because he's with KP in Hawaii? So I can cover under him and then get reimbursement for what he had to pay. Is that correct?
Yeah, I believe so. But just go ahead and contact us if you already know how what you want to enroll in and the mechanics of it. Just to confirm it with our staff. I don't want to misinform. I'm confident in my answer, but I don't always trust my answer. So I always want people to verify that, yeah, you should be able to do that.
Thank you.
Sure.
Thank you, everyone also.
I have a question on transportation service. Would I be able to order taxi cab for doctor's visit? And can I do it on spot, or you have to do it ahead of time?
So they recommend that you do it 3 days before you use the service.
So when I want to come back from doctor's office, a taxi will be waiting for me, or how does that work?
So you would be, 1 second, let me just bring out that flyer. 1 second so I can, just give me 1 moment.
And while Marisol's bringing that up, I just want to let everybody know her presentation as well as other resource materials are available on our website. If you go to the open enrollment page and you scroll down, there's a section on resources and a little link that you click, and it will take you to a page where you can see all the presentation materials and flyers.
Yeah, so to schedule a ride for Rideshare, it's taxi or private transportation, and then you would be calling the number that I provided on the slide. But as Alex said, there's a lot of resources that are available to you, and one of the resources is a flyer that explains to you the service and the phone number. So you would call that phone number directly to schedule a taxi or private transportation.
Thank you.
Oh yes, I've been thinking of possibly switching from Anthem to Kaiser. So if I do all my medical information or data, the history, how or what process do I have to go through to make sure that my medical history gets transferred over to Kaiser?
So typically, as a new member, what we recommend, our physicians recommend that we tell our members is that when you become a new member of Kaiser Permanente and you make that first appointment, you select a doctor and you make that first appointment with your primary care doctor, share with your primary care doctor your medical history in a conversation. And at that point, your doctor is going to tell you what medical records to transfer. And the reason for that is that they don't want you to transfer like loads and loads of years of medical record information that probably you don't need to, but they want to make sure that you maybe, if there's anything that he needs to make sure that your doctors see or providers at Kaiser see, then your primary care doctor will be the right person to tell you that what information he wants to see and what information to transfer. So when he tells you that, how you transfer the information is you would tell your previous providers to transfer the information to Kaiser Permanente. You would give them the address for Kaiser, medical records, and your doctor's name. And that provider will most likely ask you to sign a release form of your medical record, and then may possibly charge you to copy medical records for you. And then they can send those medical records to Kaiser Permanente's doctor directly. And then those medical records get entered into your electronic health record.
Okay, thank you. Another question regarding the Silver and Fit plan. So for members who are under 65, it's is it the silver and fit or is it active and fit?
It's the active and fit direct.
So I think somebody answered saying that it would provide similar service as a silver sneaker has.
Well, yes, the active and fit direct is pretty comparable to the silver and fit for Medicare members. And it was an added benefit this year for all Kaiser members, so they can have kind of equivalent benefits as a non-Medicare member. So the non-Medicare is called active and fit direct. And I wanted to answer if you're a new member and coming on board, if you need to transfer any prescriptions to Kaiser, if you're taking medication, one way to do that is to simply call the pharmacy that you're getting medications from. So let's say I get my medications at CVS, I would call them and then I would make sure that I know which Kaiser I'm going to be going to. And then I'm going to have my Kaiser Permanente pharmacist tech call the pharmacy that you need your prescriptions transfer, and they can transfer those prescriptions for you. So we do that for you.
Okay, thank you. One last question. I saw somebody on the chat saying that Kaiser Vision benefit is not as competitive as Anthem Blue Vision benefit. Is that a valid comment?
Do you want it?
Yeah, so, yeah, that's something that is negotiated separately, for people, Kaiser provides its own vision benefits through its medical plan, whereas our other ones do not. And so we contract separately with Anthem Blueview to provide vision coverage. They're fairly comparable, but I need to look at them a little bit more closely. I think it's definitely a good area for us to examine for our next renewal discussion to make sure we do make it more comparable, because we did change the benefits around a little bit with the Anthem Blueview a few years ago. So we'll definitely take note of that and look into that. But you can compare, sorry, Marisol, but you can compare the benefits in the health benefits guide. There's a page that shows the vision benefits side by side. And so you can see what the differences are there.
All right, thank you so much.
And I want to make a correction. I said active and fit direct. I'm sure it's active and fit. Sorry, there's no direct. There's no word direct into that benefit. It's called active and fit. Sorry, I confused it with another benefit.
That's all I have. Thanks.
Thank you. Yeah, I'm currently a Kaiser member, covered under my wife's insurance or work. If I plan to enroll to Kaiser this year, 2022, I understand then the process would be to fill out that enrollment form for Kaiser only. I just want to make sure that everything would be transitioned, or would there be transition or interruption, or how do I prevent that from happening?
Is your wife with Lacers or another organization?
She's actually with DWP. I think it's probably more a Kaiser question, because I want to make sure all my records and all of that, since it's kind of like two plan, because I'm currently under the DWP plan with Kaiser, but if I'm now going to be under the laser plan with Kaiser, I just wanted to make sure all my medical record and everything would be kind of continuous, rather than, oh, now I'm in a different Kaiser plan.
Okay, so yes, Mr. Wu, I understand your question. It was enrollment, and I was like, okay, let me see how I'm going to answer it. Now I understand it. So yeah, so whenever if you're covered by another Kaiser plan, for example, DWP, and you're now going to be covered under the Lasers plan, and you're a Kaiser member, everything's seamless to you. There's no interruption. There's no disruption. You get to pick, stay with your doctor, your providers, facilities. The only thing that changes is your plan. So you're going to be from a DWP plan to a Lasers plan. But in terms of everything else, your medical record number stays the same. again, there's no disruption to you.
Okay, thank you.
You're welcome.
Hi, I'm just sharing something about Fit and Fit and Active and Fit. That's a great program. I'm in 24/7. I'm in 24-hour fitness gym, and then monthly the annual fee is $500. And I didn't know that actually Active and Fit pays for it. So now I save $500 a year, and I can go to any gym I want to, but you got to sign up first. Not just 24 hours, any gym around my neighborhood, you can go for free. And they send you a watch, okay? Not very good, but they give you a Garmin watch. It's not iPhone. I would like an iWatch. That would be great. and other thing, they send you like yoga mat, they send you weights and DVDs. So take advantage of that. That's $500 saved. I didn't know. Actually, I paid for it already. So I got a discount from the City Club, Employee Club. That's about $290, but it's better free. So just want you, everybody, take advantage of it. If you are under 65, and of course, people that 65 can do that too. So just something I told everybody in my aging mastery program. I don't know if anybody took advantage.
Yes, you did.
So I just want to tell everybody else here too. Okay, that's all.
Thank you, Lily. And one thing I want to just stress to everybody is we have, all kinds of different programs and benefits available through our plans, Kaiser as well as the others. And, they're all integrated into the premium cost that we're paying. So take full advantage of them. They're only there to make your life better. And that's our goal for you, is to have the best retirement possible. And so, yeah, go ahead. Follow Lily's lead. Use all those benefits.
Yeah, my question is, I have received my open enrollment booklet, but my question is, I retired in May this year, and I believe that those who retired after February 2021 don't have to enroll this year. I just want to reconfirm that, do I have to do anything, or it will be next year? Thank you.
Yeah, so you never have to do anything, any open enrollment period, if you're happy with what you have. If you don't want to change your medical plan, if you don't want to change your dental plan, you don't need to do anything. It will automatically continue the next year. Now, if you did make a change during this last open enrollment period, and it took effect February 1st or after, then you can't change the change that you made this open enrollment. You have to wait until next year. But in general, if you don't want to change anything, you don't need to do anything. It will just continue.
Yeah, because I did not. Yeah, sorry, go ahead. Go ahead.
And I was just going to say, and then also just in case you are currently in the Anthem Medicare supplement plan, you will be automatically transitioned into the new Anthem Medicare Preferred PPO plan. So there's nothing you need to do for that as well. Only if you want to opt out of that transfer, then, you can call Anthem first, and, and then after that, you can reach out to us.
Yeah, no, this I want to say that this is my first year because I retired in May. So I was not anywhere. I did not make any change. So this was just like, as you answered, I don't have to do anything even any year unless I have to. That is a good answer that I was looking for.
All right. Well, just really quickly, want to thank everybody for your time and for joining us in this meeting. I hope it was useful to you. Again, if you think of any questions later on, we're here to help you. Just go ahead and give us a call or send us an email, and check out our open enrollment page on the website. There's all kinds of information, as well as a way to set up a meeting, or a phone call, I should say, with one of our carriers if you so desire. You can just go to, there's a link, a special link on our website just to do that, again, on the open enrollment page. Other than that, on a personal note, I just want to let you know that I will be retiring in a couple months, and it has been a true privilege and honor to serve you. And I hope that you feel worthy of your membership with Lacers, and I look forward to being on the other side of the screen next year. So thank you very much.